identify the patient's need for enteral feeding. This is to identify that the patient cannot voluntarily provide feeding to itself. That's why the nurses will provide the feeding through the tube. Next is we will assess the nostrils for patency and also check for skin damage. In order to assess this, we will occlude one nostrils with our hand and then determine the intensity of the air being expelled from the other nostrils and compare it to the other nostril. Breathe in, sir, and out. And after that, after assessing, the purpose of doing that is that we will able to determine which nostril is a good candidate for insertion of the NGT. After that, we will assess the patient's medical history. The purpose of assessing medical history is to determine what underlying condition that can compromise the bleeding. So we will assess if the patient has from the patent nostrils, is there a history of unusual bleeding, or if the patient has experienced some surgery from the gut part of the nostrils. And for the mental status, I will ask the patient, excuse me, sir, I am your nurse for today. Can I answer my question? Where are you now and what is the day for today? So the patient is coherent. And then after that, after determining the medical history, I will then explain the procedure to the patient. Explaining the procedure to the patient is very essential because we are helping the patient exercise their rights to be informed, and also it lessens their anxiety, it promotes comfortability and trust with the healthcare provider. So sir, today I will be inserting you a tube through your nose, and it will facilitate it down to your esophagus and to your stomach. Since, say for example, you have undergone an oral surgery, so this will be an alternative way to ensure that you will still have your proper nutrition. Then after explaining the procedure to the patient, I will inform the patient that non-verbal cues, since we know that nasogastric tube insertion is very uncomfortable. So sir, this will be very uncomfortable to you. That's why I request you to at least tap the sides of my shirt, or raise your thumb if ever you feel uncomfortable, because we need to consider the patient's comfortability as well. After doing that, I will prepare all the materials. So the materials being present or is used is first is the sterile glove, the acceptous syringe, the NGT set, the Loco Plus, the cup, the kiwi jelly or the water lubricating jelly, and then the towel for the patient's chest. After that, I will elevate the patient's position to a high phallus position, probably 90 degrees, and this will facilitate, due to the gravity, it will also facilitate the tube from going down and also prevent aspiration. But if the patient is in comatose, we will position the patient in a semi-phallus position with the head being supported by a pillow. So, sir, I will elevate here on your bed in a 90 position. And then I will cover the patient's chest with the towels, because this will serve as a basket for any oral secretions while doing the procedure. After which is that I will perform hand hygiene and gloving. The purpose of this is that we will eliminate microorganisms, and also gloving is a form of protecting ourselves. Also, we should keep in mind that the NGT tube is also sterile, so that's why we are using sterile gloves. So assuming that I am done washing my hands, And then I will measure the NGT tube from the nostrils of the patient and from the earlobe and then to the xylem process. The purpose of this is that so that we will not underestimate and overestimate the length, because if we do that, probably the position of the tube will be at the wrong organ. And then advance 2 inches. And then place a mark. After that, I will lubricate the tube in order to facilitate easy insertion. Lubricate 2 to 3 inches. And then encourage the patient to flex the head forward in order to access the nasopharynx. Sir, may you extend your flex your head forward, and then gently insert the tube.
This apart.
Okay, gently insert the tube, and then if there is resistance, encourage the patient to flex the head forward in order to facilitate further insertion of the tube. And then allow the patient to swallow with me, sir, as I insert, because swallowing also facilitates insertion. Also, during this time, I should also be mindful for the non-verbal cues of the patient, because this is the time where the patient is feeling uncomfortable.
Push on.
Up until the mark. And then secure the tube with the tape. Since this is already unsterile, I can
Just put the tube in the water with the patient, but make sure next time that you have to prepare it. Yeah? Prepare it ahead of time para diretso na lang i-cut. Every time you identify the equipment, that's the time that you're going to prepare while enumerating, prepare the tape. Sakto na siya pataas.
And then, after securing the tape, the purpose of this is that the tube will not create dislodge or displace, thus preventing irritation and trauma. And then I will now check for the proper placement of the tube.
Properly ko ano siya. Secure the wala kay step. Sige lang. Wala pinyaw. Wala ka. Water is no step. Wala sa isa. Yeah, dahil na sa mga kasama ng mga
So I will check for the placement of the tube. When checking the placement of the tube, first is I will, the first check the placement of the tube is to insert 10 cc of air and check for the gurgling sound.
Okay.
And then, after just checking the gurgling sound, I will then aspirate on gastric contents. So when I do that, the gastric contents will be aspirated. And then I will check the pH using the litmus paper. And then the gastric content is acidic, meaning it is at the right water place. Another way of determining the proper placement of the tube is also chest X-ray, which also need doctor's order. After that, I will clamp the ends of the tube in order to prevent bacterial proliferation. Then I will take it and secure it to the patient's cloth, or like what you said, circular release and everything. And then after that, I will remove my glove, discard the used materials, perform hand hygiene. This is in order to prevent cross-contamination, and then position the patient in a comfortable position, since we all know that endocrine insertion is very uncomfortable, and then we provide proper documentation. The purpose of this is that this is a confirmatory that we have provided the procedure to the patient, that it serves as a protection for the patient and the health is provided.
Let's change stethoscope and procedure.
So today, I will be performing NGT. So first is I will verify the patient's need for enteral feeding and ask if there are any allergic to food, because we need to prevent the patient from having allergic reactions. So sir, do you have any food allergies? Then after that, we will obtain the bowel sounds by auscultating it rather. The purpose of auscultating the bowel sound is in order to determine if the patient can tolerate the feed. After that, we will obtain baseline weight and review the laboratory studies or results. Obtaining the baseline weight is very essential because, of course, it will reflect how the patient responded to the feeding. If the patient is underweight and then we provided feeding and then the patient improved, it means that the patient responded very well. Also, the laboratory results will help us assess if the patient is having fluid volume deficit and fluid volume excess, or having metabolic abnormalities. After that is I will verify the physician's order. I will check the chart and verify it. Place the order. And it is the purpose of that is that the physician's order is a go signal for us to perform the procedure. And then after which is I will explain the procedure to the patient. So, sir, I will be providing you blenderized food, and it will not be the route will not be through your mouth, rather it will be through the tube that is being inserted in your nose, and it has the same process when you are eating with your mouth. All of the contents will be placed in the stomach. After which is I will prepare all the materials. So the materials being needed is first is the stethoscope, the accepted syringe rather, then the calibrated glass, 230 cc's of water for irrigation, the banderized feeding, and clean gloves. And then I will now position the patient in a high pelvis position. The purpose of this is that it will prevent the patient from aspiration, and also due to gravity, it will also facilitate the flow of the food down to the stomach. And then I will perform hand hygiene and gloving. So the purpose of hand hygiene is that it will eliminate microorganisms, and gloving, it will also protect us from the oral secretions from the patient. So, assuming I'm done hand washing. Then after which, I will go to the patient and check for the placement of the of a tube. So just like what I did earlier. So there's a gurgling sound. After which is that I will check for the gastric residual.
Wala na binilitang tampon. Hindi ka makatungong ka na wala na kung dapat ang tampon.
And after that, so when I introduce ganun air and then I pull back this part, of course the gastric residuals will be aspirated as well. And then I will check if it is like beyond 1/2 of the accepted syringe. I will place it to a cup and then report it to the physician and then hold the feeding. But if it's less, then it's okay. I will just put back the gastric contents. It also contains electrolytes. The patient will be at risk for electrolyte imbalance. After that,
Say for example, you have 30 cc of aspirated residual volume. Say for example, you fill this part, what are you going to do?
First, sir, is I will check, sir, for the chart, sir, if ilan yun ang i-administer.
30 ay muna nakuha. So, say for example, naka-aspirate ka. What's next?
I will report it to the physician, sir.
Okay, how are you going to take off the residual volume? So, use that container. Are you going to discard it or are you going to
I will give it to the doctor.
Okay. Why?
As a proof, sir, that that's the residual.
Sige, asset na muna container. Okay. Then, proceed with the next one.
After
Let's
that,
go now to irrigation.
okay, after that is that I will irrigate with water. The purpose?
No spilling. Bring to bring. Then, fill in directly. That. Ayaw ginahinayan ninyo.
And then start feeding.
What is the rationale of what you're doing?
The purpose of irrigation is that it cleanses the tube. Also, it can determines the patency, and then you will start before feeding. The third tendency is yan, then I hold this. And then the purpose of feeding, sir, is to prevent hair embolism as well.
Still have available, lubrication.
And then irrigate it with water also. This is also to clean the tube.
Mr. Polio, I want you to do this technique. That's okay since you hold this part, but you do it this way. Hold it with three. Hold it. This part should be. Hold it with your three fingers in your thumb. This one is the one that you're going to do the kinking. Okay? So you will now try it once. Anak, so mag-ana ang tulo. Gunit ang diring. Ang kanya mag-ana na siya. Okay? So it takes mastering. Can we try it one more time? Is this your dominant hand? Oh, mas easier
Pero
mo.
mas mabit
Sige. Kink it. Release it. Okay. Timing na lang siya. Na. Okay. Sige, next.
And then next is I will clamp the edge of the tube in order to prevent bacterial proliferation.
The purpose of clamping ha kay kung ano siya, kasagaran ninyo bacterial proliferation at ninyo you clamp it to avoid spillage or backflow. Because the more you open it, it will open to drain and it will drain all the secretions coming from the stomach. Okay? Remember that it can be considered as a lavage tube, right?
Yes. So after that, sir, is I will secure it with the patient's gown, remove my gloves, discard the materials, and perform hand hygiene. And then the purpose of which is to prevent microorganism contamination also. And then encourage the patient to stay at a high pilot position, probably within 30 to 1 hour. And then this is also to avoid vomiting, what we have just said. And then do proper documentation as a proof that the procedure was being done.
Place the camera